The silent struggle. When intimacy becomes a challenge. In the realm of intimate relationships, the ability to achieve and maintain an erection plays a crucial role in both physical satisfaction and emotional connection. However, for many men, this seemingly simple act can become a source of anxiety, frustration, and even shame. Erectile dysfunction, or ED, is a condition characterized by the inability to achieve or sustain an erection sufficient for sexual intercourse. It's a common concern that affects millions of men worldwide. Despite its prevalence, ED remains a taboo topic, shrouded in silence and often misunderstood. Many men suffer in silence, hesitant to seek help due to embarrassment, fear of judgment, or a lack of awareness about available treatment options. This silence can have profound consequences, impacting not only a man's sex life, but also his overall well-being and the quality of his relationships. It's important to remember that ED is a medical condition, not a reflection of one's masculinity or personal worth. Just like any other health issue, ED can be addressed and managed with the right information, support, and treatment. By breaking down the barriers of stigma and fostering open communication, we can empower men to take control of their sexual health and seek the help they need to live fulfilling and satisfying lives. Understanding erectile dysfunction. More than just a physical issue. Erectile dysfunction, or ED, affects a man's ability to achieve or maintain an erection. Persistent difficulties require medical advice. ED stems from physical, psychological, and lifestyle factors. Conditions like heart disease, diabetes, and high blood pressure can cause ED. Stress, anxiety, and depression impact erectile function. Smoking, alcohol, drug use, and obesity contribute to ED. The root of the problem. Unraveling the causes of ED. Understanding the causes of erectile dysfunction, or ED, is crucial for effective treatment. ED can stem from various factors, often intertwined. Identifying the specific cause requires a comprehensive medical evaluation. Physical causes often relate to blood flow or nerve function issues. Cardiovascular disease can damage blood vessels and reduce blood flow. Diabetes can damage nerves and blood vessels, impairing sensation and blood flow. High blood pressure, high cholesterol, obesity, and hormonal disorders also contribute to ED. Psychological factors like stress, anxiety, and depression play a significant role. Performance anxiety can create a vicious cycle, leading to further ED episodes. Lifestyle choices significantly impact erectile function. Smoking, excessive alcohol, and drug use can damage blood vessels and reduce testosterone levels. Section 4. The ripple effect. How ED impacts a man's life. The impact of erectile dysfunction, or ED, extends far beyond the bedroom, often creating a ripple effect that touches various aspects of a man's life. While the physical inability to achieve or maintain an erection is a primary concern, the emotional and psychological toll can be equally, if not more, significant. Emotionally, ED can lead to feelings of inadequacy, shame, embarrassment, and low self-esteem. Men may question their masculinity and feel like they are failing to fulfill societal expectations. These negative emotions can spill over into other areas of life, affecting work performance, social interactions, and overall well-being. In relationships, ED can create tension, frustration, and communication breakdowns. Partners of men with ED may feel undesirable, rejected, or even responsible for the condition, leading to resentment and conflict. The inability to engage in sexual intimacy can strain the emotional connection and intimacy in a relationship, potentially leading to distance and dissatisfaction. Physically, ED can be a symptom of underlying health conditions that require attention. As mentioned earlier, ED is often linked to cardiovascular disease, diabetes, and other serious health problems. Therefore, addressing ED is not just about improving sexual function, but also about identifying and managing potential health risks. Section 5. Bridging the gap. Practical tips for intimacy with ED. Living with erectile dysfunction can be challenging, but it doesn't have to mean the end of intimacy and fulfilling relationships. There are numerous practical tips and strategies that couples can adopt to bridge the gap created by ED and maintain a healthy and satisfying sex life. Communication is key. Open and honest communication between partners is crucial for navigating the challenges of ED. Sharing feelings, concerns, and expectations without blame or judgment can strengthen the emotional bond and foster understanding. Couples therapy can provide a safe and supportive space to address relationship issues related to ED. Exploring alternative forms of intimacy. Sexual intimacy encompasses much more than just intercourse. Couples can explore other ways to connect physically and emotionally, such as sensual massage, cuddling, kissing, and mutual masturbation. These activities can foster intimacy and pleasure without the pressure of achieving an erection. Focusing on foreplay and sensuality. Engaging in extended foreplay can help create a relaxed and intimate atmosphere, reducing performance anxiety and potentially improving erectile function. Experimenting with different sensory experiences, such as erotic massage, music, or lingerie, can enhance arousal and pleasure for both partners. Section 6. Seeking professional help. Diagnosis and treatment options. If you're experiencing persistent or recurrent erectile dysfunction, seeking professional help is crucial for accurate diagnosis, effective treatment, and improved quality of life. A healthcare provider can assess your overall health, identify potential underlying causes, and recommend the most appropriate treatment options tailored to your specific needs. The diagnostic process typically involves a thorough medical history review, physical examination, and laboratory tests. Your doctor will inquire about your symptoms, medical history, medications, lifestyle habits, and psychological well-being. They may also perform a physical exam to assess your overall health and check for any physical abnormalities. Blood tests may be ordered to check for conditions like diabetes, heart disease, hormonal imbalances, and other potential causes of ED. Treatment options for ED vary depending on the underlying cause and individual circumstances. In some cases, addressing the underlying medical condition, such as managing diabetes or controlling blood pressure, may improve erectile function. Lifestyle modifications such as quitting smoking, reducing alcohol consumption, losing weight, and exercising regularly can also have a significant impact on ED.